Office, as well as the Domestic Policy Council team to help convene today's discussion. And we really appreciate you being a part and sharing your perspective as educators, administrators in the K-12 system, also in the higher ed space, as parents and teachers, and we even have some students here as well. And so we appreciate that, because that's what this is all about, is putting the students first and making sure we have a holistic perspective and an important dialogue on safely reopening America's schools to respect the holistic health of students, but also their learning needs as well. And so we appreciate you being a part of the discussion today. I want to just quickly run through we're going to start here in the stateroom, a beautiful setting for an important discussion. And we're going to have 3 different panels. You're first going to hear, though, from a special guest, the second lady, and I'll introduce her in a second. And then Dr. Burks will lead a panel with the 2 secretaries. We'll have a panel on the health, the ABCs of safely reopening schools. And then we'll have a panel on those who are going to have to implement this and do it safely to, again, look out for the students and their health and their learning objectives. And so it's my honor to introduce the second lady of the United States. She's a 25-year teacher. She's somebody who is passionate about mental health of America's children and has done several projects and programs and has been recognized for her work in that space. Please help me in welcoming Second Lady Pence.
To lower this a little bit. Thank you, Doug. It's my honor to welcome all of you to the White House today for today's summit on safely reopening our nation's schools. And I have a bias here, so I'm putting that out there right from the beginning. But it's so great to see so many education leaders here who are working on plans to get our kids back to the classrooms and our college campuses, but in a safe and responsible way. We all know we've faced some very challenging times these past several months, but today we are encouraged. Americans have made great sacrifices to slow the spread. Healthcare workers have demonstrated incredible dedication, and American businesses have stepped up. And every state in this country now is open. Parents have been the unsung heroes in this pandemic. I am so proud of the mothers and fathers who wore multiple hats and took on the enormous role of educating their children during this pandemic. And I'm really proud of the kids who were patient with their parents. I've heard many stories, though, from parents who shared their struggles with me. This was not an easy time for parents. They had to become teachers and tutors overnight. And a lot of them were still working from home, sharing the computer with their children. And I know you all in this room, you understand better than most that our children made a lot of sacrifices during the past 3 or 4 months. They gave up playing sports, participating in other extracurricular activities. They missed out on field trips, prom, sharing moments with their friends. Most students had to say goodbye to their classmates virtually because we all thought we would be back. And they had to receive their diplomas in the mail instead of a graduation ceremony. We had a graduation ceremony at our house with just 4 of us for our daughter. So now, as the country reopens, many parents are returning to their offices to work. But if schools remain closed in the fall, we know this decision will have a tremendous impact on families. Sally Goza, where are you? We're so glad that you're here today. Sally is the president of the American Academy of Pediatrics. Thank you so much for your leadership on this. You are playing such a key role. But they released a statement, and I'm going to read your statement, Sally. The American Academy of Pediatrics strongly advocates that all policy consideration for the coming school year should start with a goal of having students physically present in school. As a teacher in an elementary school, I understand the benefits of having the students back in the classroom, but I will tell you, my school, we are changing a lot of things in the way we're going to do them in the fall. I was on a conference call this morning talking about students having their own art supplies this year. We're not sharing like we normally do. I'm not going to be teaching from my art room this year. I'm going to be going class to class. There are a lot of things we can do to make our schools safe. We know the value of in-person learning. It's well documented, and there's evidence of the negative impacts on children because of school closures this past spring. We don't want our children to fall behind academically, and returning to the classrooms will help our students get back on track academically. But in addition to achieving well academically, we know that schools offer our children an opportunity to strengthen their social skills. And research shows that lengthy time away from school can impact a student's mental and emotional well-being. And for me, being away from my students has affected me that way. I miss my kids. I miss them. So as we continue the conversation about reopening our country, we must not leave out our schools. Thank you so much to all of you for being here, and thank you for your strong leadership on this important issue. I'm actually headed to another event right now, so I won't be staying with you. We're launching today a public health campaign for our veterans. It's called REACH, and the president asked me to be the lead ambassador for Prevents about 4 months ago, which is the president's roadmap to empower veterans to end a national tragedy of suicide. We need to take care of our vets, but we need to take care of our kids. And right now is the time to recognize that we want to prevent these emotional, mental health challenges that our kids will face if they don't get back into school. So now I'd like to invite Secretary Alex Azar, Secretary Betsy DeVos, and Ambassador Deborah Birx to the front of the room to begin the first panel, and I look forward to seeing you all this afternoon at 3 o'clock. Thank you so much.
Thank you, Mrs. Pence. Thank you all for coming today. I just want to open by really thanking those who have been helping me from the very beginning. The president and vice president very early on recognized the trauma this was having to our children and asked me immediately to check in weekly with the American Academy of Pediatrics and the American College of Obstetrics and Gynecology, really to ensure that babies were born healthy, and then the American Academy of Pediatrics raising their concerns that we could take back to the task force. And I want to thank you for all those early morning calls where many people, I don't know what time zone they were in, but they were early for me, so they may have been very early for them. And I think from the very beginning, they wanted to raise the awareness of the whole child, where COVID-19 was one part of the analysis, but not the complete analysis, where we would look past the one dimension of COVID and public health to the multidimensional lives of children and their families for emotional, physical, and really comprehensive health that really occurs oftentimes within the setting of our school systems. So it's really my pleasure to have Secretary Azar and Secretary DeVos, who through this entire stress of the last 5 or 6 months have been focused on this particular area. So I want to give them a moment to give their opening comments, and then I have some questions for them that hopefully also reflect the questions that you have for them. Secretary Azar.
Great. Well, thank you very much, Ambassador Birx. So thanks to what Ambassador Birx, President Trump, Vice President Pence have done over the last 6 months through this historic response to this unprecedented pandemic, we have the tools to get back to work, back to school, and back to healthcare. So we're talking about the middle one today, which is we can get back to school. We can do so safely if we all think smart, if we accept our individual responsibility and our collective responsibility to act within a smart framework. And the Second Lady actually talked about a couple of the things that we can do to be back at school safely. And I'll talk first K through 12, because we've put out CDC guidance that can be of assistance to our states and our local leaders in reopening. And along those lines, I want to emphasize something the Vice President said to our nation's governors just a couple minutes ago, emphasizing a point that Dr. Redfield, our CDC director, made. Our CDC guidance is guidance. When it comes to reopening our schools, nobody should hide behind CDC's guidance as a way to not reopen schools. Our guidance is to enable and empower the reopening of schools and physical attendance by our kids. So as you think about K through 12, though, just think about the core elements of the Surgeon General's prescription for healthcare. First, what's your individual circumstance? Are you or a family member someone you live with particularly vulnerable at risk, and take appropriate action accordingly? Second, what's going on in your community? Are you in a community that has large-scale spreading of disease, or is it relatively isolated? Third, what's the type of activity that you're contemplating? And that, so is the school activities. How do you think through that? And then there are 3 core things that everybody should be doing. First, social distance. Maintain appropriate distance among the kids and with staff and faculty. Second, wear facial coverings when you can't appropriately social distance. Of course, we're socially distanced here. We've all been tested. It's a very different circumstance than our normal lives. But wear facial covering when you can't social distance. And frankly, in a school setting or anything crowded like going to a grocery store, wear facial covering because you're not going to be able to ensure social distance in that setting. Third, practice good personal hygiene. I know it's tough with kids, but it'll be a good lesson. And if you do those 3 things, then it's just smart practice. So setting up the desks in the classroom in a way that has appropriate social distance. As the Second Lady said, have the teachers rotate rather than the kids. Avoid congregate settings like auditoriums, assemblies, cafeterias. Have individual meals brought into the kids, stagger classes, what have you, to just avoid those collections. It's not going to be the full experience. It's not going to be the recess experience. That's also really vital to kids. But it's something, it's physical. And as the American Academy of Pediatrics has said, there's an emotional, mental health, physical, and intellectual development toll that happens from our kids not being back at school. And then as we think about colleges and universities, we have to get them back up and running again. And there are ways that you can do that, the same types of tactics there. And I encourage our university leaders, I've got a kid in college, so I get to see both high school and college right now. Think about unintended consequences also. And this isn't the health secretary or CDC making an official recommendation, but I see a lot of universities talking about restricting the number of kids that can be on campus. Okay, well, that might make sense from a social distancing perspective, but do think about the other side of the coin, which is if those kids are just going to be getting houses or apartments in the same school community and, quote, distance learning instead of showing up in class, but then doing all the socializing and interacting without social distance and without facial coverings that you, the university administrators, now don't have control over because they're off campus, be thinking through those dimensions. You see a lot of unintended consequences from very well-meaning actions and plans. We've got a lot of tools that we've built, testing, surveillance tools that you can use to get reopened, to keep kids, keep faculty, keep staff safe. But we must reopen. We've got to get people back to work, back to school, back to health care because we can't stay locked in our homes forever. It's bad for our physical and mental and emotional health, us as adults, as well as for our kids. So thank you, Ambassador.
Thank you, Mr. Secretary. Madam Secretary DeVos.
Thank you so much, Dr. Birx and Secretary Azar, and thank you both for your continued solid leadership on the task force as we have navigated these last few months. I'm really honored to be here with so many school leaders who have been thinking and planning today for how to ensure students can be back in school in the fall, and especially appreciative of Secretary Azar's comments about thinking practically about the implications of not having students back together in a learning environment. Our expectation should be that they will be. And there has been a lot of guidance written, a lot of practical thought given to how this can happen, acknowledging that every state and many regions within states are different and have different circumstances and may require different solutions. But I am constantly amazed and gratified by the ingenuity and creativity that the American people show when faced with a difficult situation. And we know today that there were too many kids who didn't have the opportunity to continue learning these past several months. I've spoken with every state school leader at least once, most of them more than once, and they said within their state there were a number of districts that learned how to do it well and pivoted quickly to a distance learning environment, and there were others who frankly just gave up and didn't expect anything, and that's just not an acceptable solution going forward. So when we talk about schools being fully operational and fully functional again in the fall, we can also acknowledge that in some places where there might be a flare-up, it might look different for a period of time. And we can, that would be okay. We can plan for that. But our expectation should be that students can be back together in the fall, whether it's on K-12 campuses or in higher ed environments as well. And I want to especially thank again the American Academy of Pediatrics also for their thoughtful approach to this, because we know that for so many students, the school environment is the best place for them to be, and they have got to continue to develop themselves and not go through another several months to a year of really sort of biding time. So I'm looking forward to our conversation today about how we go with the expectation of students continuing their learning, and looking forward to all of the expertise here in this room. I also want to just give a little shout out to the State Commissioner Richard Corcoran in Florida, who just released a plan yesterday, which is very comprehensive in nature, and there may be other states and other communities that want to look at that, but again, with the expectation that students are together and that families will be able to count on a 5-day school week if that's the right answer for them. So looking forward to our conversation. Thank you, Dr. Birx.
Great. I'm going to ask the secretaries some questions. I just have to stop for a minute and recognize I have two incredible daughters who have been home with 2 grandchildren, and they have what I think sometimes we underestimate children's ability to adapt and understand the situation when they go back to school. Because I was struck by you saying they may not know the hand washing and the personal hygiene. My 2.5-year-old knows pandemics now and germs and how germs are transmitted, and knows the importance now of washing our hands, which we would have never spent any time on before. We just would have ignored that whole thing about hand washing. But the other thing that she's adapted to is the fact that grandma and grandpa can come over, wear masks, be 6 feet apart, and she knows that she cannot invade each other's space. And I think they can learn that also about each other out of respect for each other. Even 5-year-olds, if a 2.5-year-old can understand this. So it's amazing how they can follow rules when they're repeated. And I know every parent has been spending the last 4 months repeating that to their children in preparation for them to go back to school about what this really means. So, Mr. Secretary, you have amazing operating divisions that are able to look at all aspects of children, from mental health to physical health to intellectual health to development. Can you share your concerns based on all of that information coming into you about the benefits of being in school versus being in home for the child?
Yeah, and I don't want to preempt everything. I know Dr. Ellie McCants-Katz, who's our administrator of SAMHSA, the Substance Abuse Mental Health Services Agency, will be on the next panel. But schools are important and critical, not just for educating. They are actually the center of so many children's entire healthcare, mental health, social life. A great deal of nutritional support occurs in our schools. A great deal of our mental health counseling and support occurs in our schools. Most of our mandatory reporting for sex abuse or other types of on-child crime occurs in the school-based setting. And we lose all of that when they're not physically together in the school setting. So it's not just about the reading, writing, and arithmetic type learning. It's also the entire network that we have built around our children and the support system for them that exists only in that physical learning environment. And I'm sure Dr. McCants-Katz will talk in greater detail about some of the data that we have supporting how critical that setting is for kids.
Thank you, Mr. Secretary. I know that's what the Academy of Pediatrics brought to me at the very beginning, that both the telehealth, which we fought for pediatrics to be a part of, but also the fact how much the pediatrician and the school teacher all work together to really support the whole child, and how concerned the American Academy of Pediatrics was on the mental and emotional health of our children that may be in more vulnerable situations. And I think in the rush to just close things down, everything was not completely considered in that moment about how we were going to protect our children. I know, Secretary DeVos, you've been working with school system after school system to really work on these best practices on how to keep learning going. And these would be the practices that a school for a short period of time could default to in a moment of a week or two if there was an outbreak. Could you talk a little bit about what you've seen about really what creativity people have brought to this?
Certainly. There were many schools and many districts that did an awesome job of pivoting from in-person learning to distance learning this spring. I'd like to highlight just a couple of them that I'm aware of. I'm sure there are many others, but in New York City, Success Academy, a chain of charter schools that serves tens of thousands of students, mostly vulnerable students, frankly, in their school population. And within a week, they had shifted to distance online learning, and without really missing a beat at all. And it stood in stark contrast to some of their neighbors. A very good model for others to look at. Miami-Dade County, a large and diverse county. Many of you here in this room very familiar with the demographics and geography there. Miami-Dade had a really solid instructional support system that allowed for them to move to a virtual distance learning model, and had extra interventional supports for those who needed that extra boost. Another very good model for folks to look at. The International Leadership Academy in Texas, they took the attitude that learning and instruction must continue no matter what the circumstances are, and they made a really impressive shift again to the distance learning opportunity. A couple of examples closer to home here to Washington. There's a couple of suburban districts here that didn't do a very good job, frankly, and I've heard firsthand from a lot of folks whose children are in those systems how disappointed they were with really the lack of effort and the lack of competence and focus around getting helping students to continue in a distance environment. And then there is another one here in suburban DC who is offering learning through summer sessions to all of their students this summer. So a very uneven application, but all that to say, again, our expectation should be that students, no matter whether they're hopefully in person, and that should be absolutely the goal, for students to be able to be in person in school, but if whatever the circumstances dictate, require some distance for a while, if there's a flare-up of the virus in that particular school or in that classroom, that there are plans in place to be able to shift to immediately, and that can be done seamlessly. I've also heard of a lot of very creative thinking going into how to minimize the risk of students being together in the fall, and thinking about things like, where do you have choir and where do you have band? And I have heard a lot of discussion about thinking anew about learning outside as long as the weather is good, and putting up little temporary coverings or tents to be able to hold your choir classes or your band classes outdoors, where you have a lot more fresh air. And I know the medical folks among us would probably say that's a good idea. But thinking about those sorts of situations in ways that are unique to your particular school or your particular community is an imperative for all of us.
Thank you. That was so well said. And I think part of the reason for this dialogue today was to really look past and within the first dimension of where we exist in COVID-19, but to bring together those other dimensions, not only the physical, specific health around COVID-19, but the emotional and mental, intellectual health. And I think, Mr. Secretary, you talked about that at the beginning, and we have brilliant people here sharing with us, and we'll be in that third panel. But how are you tackling kind of the risk-benefit relationships of all of these different factors? And is there a way that we can bring not only a whole of government, but a whole of thought process on the three dimensions of a child and what they need, rather than the unidimensional piece of COVID-19? And how are you thinking about that?
Well, and I think we see this not just in the school context with kids, but just generally, as we talked about work or healthcare. In the healthcare setting, I've been trying to make it clear that too often we're talking about health versus reopening the economy. It's a balance between, are we going to have economic activity and healthcare, where I actually think it's health versus health. And so we're seeing kids not getting pediatric vaccinations. Millions of children are not getting pediatric vaccinations. People are not getting preventive screenings. They're not getting diagnosed for cancer. Hundreds of thousands of people are not getting diagnosed with cancer. People are literally not presenting in emergency rooms with stroke and heart attack. They didn't stop having strokes and heart attack. They're not presenting in the ER, where time is muscle and time is brain, and they need to get in. And the long-term, very real health consequences for adults and children of being locked down in your home are going to be with us for some time. And then you add the mental health issues for the kids. Children are social beings. We're all social beings, and we need to have that interaction. And we already have enough of denial of that through social media and everything else, and then we take away the physical side of it at school and those fora. And I think any one of us in this room can see in our own children the impact it has on them. In some respects, we're lucky being essential and having to go to work. We don't actually get to and have to feel all of that personally. That experience. It's important that we deal with the disease. Dr. Birx can talk more about, why we did the initial slow the spread. But that was because of a need to flatten and delay the curve of disease while we built up tools, health system, personal protective equipment, advanced on therapeutics and vaccines, learned how to deal with this disease. But now we have tools where we can manage through if we act responsibly. Acting responsibly, by the way, does not mean going to a very, very crowded bar in an outbreak area without facial covering, That would not be good individual responsibility. If we act with good individual responsibility, protecting ourselves, protecting those in our households, and protecting those that we interact with in normal society, there's no reason we can't do any of this. We have healthcare settings. We have healthcare workers. They don't get infected because they take appropriate precautions. They engage in social distancing. They wear facial covering. They use good personal hygiene. This can work. You can do all of this. There's no reason schools have to be in any way any different from the rest of what we need to do on opening ourselves up.
I think you made some just really terrific points. And you know what? I'm sure you all feel this, that what's happening today with our outbreaks across the South, where they didn't really experience March and April in the same way the Northeast did, the Mid-Atlantic, and the Midwest. Yet their case fatality rates are very different than they were in March and April. And I think that's because of what you just described. It gave hospitals and clinicians the ability to learn how to do better care, and critically, how to bring better therapeutics early on into the disease. And we've learned about the spectrum of disease, which frankly we didn't know when this started. All the data said about 17% were asymptomatic. We now know it's way over 50% for people under 30. And that means that they don't have any symptoms. And as we work through this and we get some antibody levels, we'll see precisely by age group who really has been exposed with no symptoms at all, and who we have to really worry about in a very clear way. And that allows us then to focus our resources on protecting those vulnerable teachers, those vulnerable administrators, while we continue to have children in school. And I know, Secretary DeVos, you've really thought about the importance of the in-school experience. And just as our last answer, if you could talk a little bit about why you personally believe it's so important for children to be in school, and why we're holding this today to really emphasize that point.
Well, thanks, Dr. Burks. I think both you and Secretary Azar have articulated some of the important reasons, but as you've noted, children are social beings. We're all social beings, and not being able to be together with students of similar age groups and with friends over extended periods of times, it's unhealthy for anyone. And we've noted the fact that with everything in life, there is some level of risk. And it's a matter of assessing those risks and taking all the different factors into account. So not only physical health and safety, but also socio-emotional health and mental health, and also the opportunity that a school environment provides for all students, particularly the most vulnerable students and students with disabilities who really need to be in classroom settings, many of them, in order to continue to develop themselves as a person. And so it can't overstate the importance of the need for schools to be open again, and for students to have that opportunity to learn together in person. And I would just encourage all those involved with those discussions to listen to the parents and listen to what their experiences have been, and work together to find the right solution for your community and your schools, because it is imperative that students continue to learn.
Maybe you both could quickly, as our very concluding piece, what should really parents expect in all this? Because we haven't really talked about that. So Secretary Azar, what should parents expect and hold the counties accountable for, since it's their tax dollars that are going to support the schools? What should they expect schools to do for them? And then Secretary DeVos, same question.
Well, I think they should expect that the schools can deliver a safe learning environment for their kids, even when we're experiencing a pandemic of this sort. And that means taking the reasonable and appropriate precautions in the school to protect children, to have appropriate surveillance systems and appropriate social distancing, facial covering policies, enforcement of these, and good personal hygiene. And I don't think that's too much to expect. It's actually fairly basic. Common sense. All of this is very common sense if we just will live up to it. It doesn't have to be extreme. we can take a very reasonable course here, a balanced course. And that's what parents ought to expect, because those parents have to get back to the factory. They've got to get back to the job site. They've got to get back to the office. And part of that is their kids, knowing their kids are taken care of.
Secretary DeVos? Well, I don't think I could express it any better than Secretary Azar has. I think that that's exactly what parents should expect. I also think, I would just add that I think that adults demonstrating grit and determination and resilience is an important factor here, and it's important for kids to see, it's important for students to learn.
Thank you. If you could just join me in thanking this wonderful panel. It's a privilege to be here with all of you. And we're ready for the next panel.
Thank you very much, Dr. Birx, for
And I'm pleased to be moderating this very distinguished panel.